friends from Auslan is putting up an Auslan video of the conference as soon as we can, straight after the conference concludes. So there are 2 cases in today's numbers that we have reported. Both are linked to the existing outbreak and have been in quarantine for their period of their infectivity. And Kate Matson will go through those details shortly. Yesterday, we also vaccinated 15,030 Victorians in our state-run clinics, and we tested 21,417 people for coronavirus. 99.2% of those tests were turned around over the course of the day. Another testing milestone was also reached yesterday, with some 500,000 tests for hotel quarantine staff now being processed since the compulsory testing of staff commenced some time in December 2020. That makes more than 1 in 9 tests that have been conducted for coronavirus in Victoria have been through our hotel quarantine staff, and I want to thank them for their outstanding cooperation given the high risk area that they work in. Our teams have also been following up the orange zone arrivals who entered Victoria, particularly from southeast Queensland, before the 8 p.m. turn of that zone red on Saturday evening. Most have obtained their negative test results, and we note that the orange zone arrivals have some 72 hours from their time of arrival to get that negative test. Those who have yet to do so within that 72-hour time, given the increasing risks in southeast Queensland, can expect to be phoned with a reminder over the course of today. So please, if you are one of those people who have returned from southeast Queensland, come forward and get your test and isolate until such time as you get your negative result. And what we will also be asking is that those people in that area of previously orange zone returnees also get a day 7 test, and we want to do that out of an abundance of caution given the arrangements that I understand southeast Queensland have foreshadowed an extension of their lockdown. So that is that some 11 local government areas in Queensland are now that red zone as of 8 p.m. Saturday, and all of New South Wales continues to be an extreme risk zone. That extreme risk zone material and status along particularly the Murray continues to be an area of concern for us, and what we want to make sure is that movements across the Murray and the Victorian New South Wales border are as limited as possible. Yet at the same time, we want to make sure that the people and communities on both sides of the border have a function as reasonable as we can system in place to keep those very integrated communities functioning safely. And we want to balance the ability to people move freely with keeping that movement COVID safe. Currently, people living in the cross-border areas in New South Wales can enter Victoria for any reason without a permit, provided that they meet the conditions of the border bubble exceptions. But as the outbreak in New South Wales continues to grow, and with projections and modelling suggesting that the position in New South Wales is likely to get worse before it gets better, it's prudent that Victoria takes measures to make sure that the border bubble operates as safely as we possibly can. Particularly given that we are just emerging from another set of restrictions that resulted from COVID incursions from New South Wales, and before that, South Australia. So we really do need to take steps in that border bubble area that keep us all safe. So we do need to limit particularly non-essential movement across the border where it is both practical and possible to do so. That's the public health advice that the Chief Health Officer and his team have provided government, and we are acting on that advice today. So I can advise that the Chief Health Officer has recommended strengthening the Victoria bubble border arrangements with New South Wales as of 11:59 p.m. tomorrow, Tuesday, the 3rd of August. Under the changes, residents in the Victoria-New South Wales border bubble can only cross the border and enter Victoria without a permit for 6 very broad categories of activity. Firstly, for necessary goods and services, including medical care and getting tested. Secondly, care and compassion reasons. Third, paid or voluntary work. Fourth, education, including childcare. Fifth, getting a COVID-19 vaccination. And sixth, for sport and exercise. We provide more details of these arrangements through our media release and through the processes of engagement with those communities. These permitted reasons also apply to Victorian border bubble residents who plan to enter New South Wales. So you'll need to have observed the essential reasons for travel while in New South Wales if you wish to return to Victoria without a permit. Fines will apply for people using the border bubble permit exception for non-essential reasons. And just remind everyone that the fine is up to $5,492. People crossing the border to enter Victoria for one of the essential reasons must also not travel further than is reasonably necessary for the particular purpose that you are entering into the border bubble. In other words, if you're from Albury, please don't shop in Wangaratta, Werribee or Warrnambool if the essential reason for your travel can be attended to in Wodonga. We really don't make these changes lightly. We know that it will have an impact on many border residents, but we also know that an outbreak of the Delta variant on our doorstep will have an even more negative impact on our border communities. Our current border bubble system is based on the pre-Delta era of how we've managed the COVID-19 virus. We need to have our border bubble reflect the changes that Delta has brought to how we respond and manage to the COVID-19 global pandemic. The current rules predate also the increasingly uncontrolled outbreak that we're seeing in New South Wales. They predate the simultaneous lockdowns that we've seen up and down the eastern seaboard, and that we really have to respond a proportionate and measured system that keeps our borders as safe as possible from further incursions of COVID-19, whilst balancing that against the real needs of our border communities to operate as safely and effectively as they possibly can. And so that's why we are updating the settings based on that balance and on that best advice. Government departments and agencies on both sides of the border will continue to work very closely with local government, communities, industry to make sure that these changes are implemented as smoothly as possible. And before I hand over to Deputy Secretary Matson for more information about the outbreak response more generally, Chief Health Officer is also, as of 11:59 p.m. tomorrow, just tweaking a couple of the settings, and that is one change to the directions that will apply as of 11:59 p.m. Tuesday. There will no longer be limits to group bookings for hospitality venues, tours and gyms. However, the broader density limits that were announced last Tuesday will continue to apply. And that was in response to some suggestions that came forward from industry as to how to best manage that issue. I might ask Kate to add some details, and then we're happy to take questions. Thanks.
Thank you, Minister. Good morning. Of the 2 new cases in this morning's numbers, one is a household contact linked to a case who attended Amy Park, and another is a household contact of last week's Moonee Valley traffic controller case. That is now a total of 216 cases linked to this most recent outbreak. Unfortunately, there are 8 cases in hospital, including 3 in intensive care, and we send our best wishes to them and their families as they recover. Yesterday, our teams cleared 1,300 primary close contacts, so there are under 4,000 remaining from the most recent outbreak, from a height of more than 25,000. Again, we thank all of those primary close contacts for doing the right thing throughout their isolation period, and I will also thank the teams at the department and our local public health units who've worked so hard over the past week to clear so many. We now have only 56 exposure sites on our website from over 300 at the peak of the outbreak. Happily, we've identified 185 close contacts from the Woolworths Devon Park in Doncaster, and we've received 78% with a negative result. We're continuing to support close contacts in a number of apartment buildings across Melbourne. At the new site in Richmond that was spoken about in detail yesterday, all residents have returned an initial negative test. We'll continue to support them throughout the 14 days of isolation. Our household engagement program visited 570 people yesterday and saw an extremely high rate of compliance with those people isolating at home, and I thank again those people for doing the right thing and supporting Victorian throughout this outbreak. Finally, I'll just touch on our exemption process from our domestic border system, traffic light system. We have 6,984 applications in the system for exemptions from those who've come from red or extreme risk zones. Our teams are working through these as quickly as possible. However, each one of those exemptions does require a review from the public health team. That means we process only about 1,000 a day. We thank everyone for their patience and understanding as we work through the backlog in the system. However, I do want to note that approving those exemptions is rare. Most people who apply will not be successful in getting that exemption. Those who do tend to get them for really compelling, compassionate or emergency grounds, such as end-of-life reasons, to attend funerals and so on. We really do understand for those people in those difficult circumstances. It can be really stressful waiting for the exemption result, and I reassure you that we are working through those as quickly as we can. However, if you're not applying for one of those emergency end-of-life reasons, we would ask that you hold off for now and understand that we will be prioritising those emergency reasons so that we can move through those exemptions more quickly. Thank you, and I'll hand back to the Minister for questions.
Thanks, Kate. Happy to take questions.
Minister, has there been any COVID cases in the bubble, the water bubble?
No. Well, having said that, clearly we did have the outbreak in Mildura, and that is, of course, part of the bubble.
So what's prompted these rules? Like, is it just the concern out of New South Wales? There's no incident coming into Victoria that's actually prompted these rules?
Well, the advice from the Chief Health Officer was, given the deteriorating situation in New South Wales, and particularly given the likelihood and the risk that the spread out of the Greater Sydney region into other areas, which we've already seen a few incursions, that the time was now rife to reassess the border bubble risks in light of particularly the Delta variant of concern.
Given the rate at which it's actually spreading through regional New South Wales, though, can you understand there'll be a bit of concern and I suppose anger on our border that it's getting stricter for these people to move about, where in a lot of cases there hasn't been any infections at all?
I think along our border communities on the south side of the river in particular, particularly after the incursion into Mildura, that border communities know that the Delta variant has changed the rules, and we want to make sure that the border bubble continues to operate, but for essential reasons. I would have thought that Victorians would have been a little bit surprised that you could holiday if you were in the border bubble on the New South Wales side in Lorne if you wanted to, or that you could have shopped in Bourke Street if you wanted to. We need to make sure that the arrangements for the border bubble reflect the functioning of the border bubble communities whilst keeping all Victorians safe. And I think these arrangements achieve that balance.
Was there any evidence that people had actually been doing that?
Well, they were perfectly entitled to it. So in terms of how people on the New South Wales side of the border bubble chose to exercise that, that was totally in their hands, so there was no restrictions on their movements. What we want to make sure now is that the restrictions are for what is reasonably necessary to deliver the goals of the border bubble.
Just on the rules, it says here that there's an alpine areas are exempt. So can you still, if you're in New South Wales in the border bubble, holiday or ski?
No, the other way around. That if you're in the New South Wales border bubble, you cannot come to Victorian resorts. So there's, for instance, there's passes that include Perisher and Falls. So and it's the one pass. So, for instance, that wouldn't apply. That if you've got if you're in the New South Wales border bubble on the New South Wales side, you cannot come to Victoria's ski resorts.
What about Victorians that are currently trapped, many of them with caravans, big vehicles, trapped in Queensland? They're saying they're being told that the only way they can get home is to drive 24 hours straight through New South Wales. Clearly that's dangerous.
Within reason, we encourage safe travel, and that allows clearly the purposes of trying to stay out of metropolitan Sydney, obviously, but for safe arrangements that we saw not dissimilar to, but without hopefully the logjams that we saw over the Christmas New Year period. If people are holidaying in regional Queensland, then of course they're entitled to safely and carefully travel through New South Wales. We don't want to see any accidents, we don't want to see any untoward activities, but by the same token, we want to make sure that people move carefully and timely through rural New South Wales in the safest possible manner.
They say they're being told they can't stop and they've got to do it in 24
Well,
hours.
They can stop for fuel and rest breaks, but we would encourage them to keep moving. Yes.
So they're not allowed to stop overnight if it's...
Correct.
So if that's not dangerous, it's pretty tough going if you're going 1,300 kilometres.
It is, but equally we've made it clear for many, many weeks now, indeed before New South Wales turned red and indeed extreme red, extreme risk, that these changes were on the cards. And I have a great deal of sympathy for anyone in those circumstances, but it shouldn't have come as a huge surprise.
These border towns are actually closer to Melbourne than they are Sydney, so is this a proportionate response?
Yes, we do believe it is a proportionate response. We want to make sure that the arrangements in place on both sides of the border bubble allow those communities to function as effectively as possible, but for the reasons that are essential, the reasons that keep jobs as much as possible happening, that keep kids at school, that keep care opportunities, health services and community sport operating in a manner that binds those communities together but operates in a safe manner. Because as various projections point out, including admissions from New South Wales government leaders, things in New South Wales are expected to get worse before they get better, and we want to make sure that our border bubble arrangements are based on that risk assessment.
What would trigger the lifting of these rules?
Well, like all rules, we continue to monitor the situation that has driven them, and in this case it's the New South Wales outbreak. And when the New South Wales outbreak gets better, as ultimately it will, then I'm sure we'll review the rules.
Does that also mean
If it gets worse, we have to foreshadow that the rules might get tougher.
But just on that, following up, is there a case for if cases aren't seen in regional New South Wales or the ACT that you'd look at reviewing these rules if cases remain?
I wouldn't foreshadow that because all the projections that we've seen, including New South Wales Government's own admission, is that the situation in New South Wales is likely to get worse before it gets better. So we need to have, as a precaution, our defences in place along the border, which continues to be the area of greatest risk for us, proportionate to that risk.
Does that mean the ACT is also likely to remain a red zone until New South Wales outbreak is gone?
Well, the Chief Officer continues to review that, discusses those arrangements with his ACT counterpart. The ACT is a different government to New South Wales, so it's largely in its hands as to what its measures are. But of course, the challenges that the ACT face is that it's surrounded by an extreme red zone.
Are there any measures, Minister, that you're either taking or considering to try and, pick up proactively infections that might come through by New South Wales rather than waiting for them to come up in general testing?
Indeed. Like we've already seen a tightening of the freight arrangements, and we continue to work with the freight sector and others as to what other measures we might be able to have further security of arrangements in place for that sector to keep it operating, and we'll continue to review other options that come forward as to what that might mean where incursion is a real possibility.
So is there more testing in high-risk kind of border areas? Are there going to be more
Potentially.
Besides on trucking routes?
Correct. That sort of thing is always being looked at, but we've got nothing further to add just yet.
So that 2-week ban on removalists is coming up. Is that being extended?
I haven't got anything to announce today, but as the situation in New South Wales continues to deteriorate, we would expect our measures to at least be held at their current level for arrangements coming in from New South Wales.
And just on the restrictions week that you announced for hospitality and museums and the like, is it still seated service, or are you allowed to set up?
So the change, the Chief Health Officer will include this in their material later, but essentially it's a group booking arrangement which was limited to 10, so that would have an impact on, say, group bookings in hotels or on tourism, buses, or all sorts of things. So whilst the overall limit of 100 or 300 inside or outside will continue to apply, the group booking limit on 10 will be removed.
So there's no limit anymore on the...
Well, other than the density limits of 100 or 300, but the restriction on 10 as the group booking is the element that's changed.
And so on-site seated service, will that remain until next Tuesday?
I believe so, yes.
Yeah.
So the existing arrangements that were announced for 2 weeks that came into effect from 11:59 p.m. last Tuesday still have another 8 days to run.
Are we on track for a further easing next week?
Well, as the Chief Health Officer indicated yesterday, these matters are reviewed day by day, but today's results of 2 cases in quarantine, in isolation rather, their whole period of infectivity with no further exposure sites, that's another good result. No COVID case is a great result. Victorians have worked extraordinarily hard yet again to get us into this position, and I think the Victorian community wants to take the careful necessary steps to protect that whilst opening up as much as we possibly can. And so that balance particularly given, as we're seeing, Queensland, southeast Queensland and New South Wales respond to some really challenging situations. That balance, I think, is reflected in the Chief Health Officer's current restrictions.
Are you contemplating bringing that deadline forward? If hopefully, as Mr. Sutton said yesterday, there may be 0-0 early this week. Would you contemplate bringing that deadline forward if we hit that mark, because businesses are struggling so much, particularly in the hospitality and the tourism industries?
So, as the Chief Health Officer has shown by just that tweak for group bookings, the public health team are always open to sensible suggestions, but equally the team made it pretty clear that the 2-week arrangement was in place for that careful, stepped process of managing the Delta variant of concern, twice as infectious as previous arrangements, previous versions, and a real challenge to keep that as under control as we possibly can, whilst gradually and safely reopening the Victorian community.
Minister, case numbers in New South Wales and particularly Sydney are coming down. There's been a lot of discussion on whether Sydney should go as hard as Melbourne last year. Do you think the curfew and the travel limit helped outbreak, and do you think it's something that Sydney should consider?
Well, look, I'll just rely on independent evidence such as that of the Burnett and others who have put out into the public realm and as recently as today released in the Australian Medical Journal reports that suggest that very thing. That was a package deal of going hard, making sure that the measures that were in place took all of the greater Melbourne area into a consistent, really tough pattern of measures. But we've shared our views with New South Wales. It's up to them if they wish to adopt that.
Minister, with the booking limits on hospitality, tours and the like, how is having, say, 15 or 20 people at a restaurant safer than 2 people visiting a home?
Visiting a home?
Yeah.
On the basis that there's a whole range of measures that are in place at a hospitality or an organised venue, a QR code system, the industrial scale cleaning that goes with it, the really conscious measures that so many hospitality venues are rightly now taking in place when it comes to density quotas. Those measures allow those facilities to reopen, but it also allows them to reopen safely. What we've seen throughout this last 18 months is that it is in our home that we let our guard down, perfectly understandably, because it's with the people we know, the people we love, our families, our friends. And we've seen, particularly when it comes to the Delta variant of concern, what the epidemiologists call the strike rates of Delta in going through residential and home settings in terms of its infectivity is much, much higher. So the inescapable truth of the public health evidence is that it is actually safer in many regards if you're going to get together in those controlled environments rather than in our domestic home environments. That will change, I'm sure, once issues around vaccination levels and making sure that we've got our cases down as far as we possibly can in this intervening period. But for the moment, that's why we have still the ban on home gatherings.
So what's your advice to, say, someone that doesn't have money in their household budget to take a family member out for lunch? Yeah. What should they do?
There's still the opportunity to get together in public areas, in parks, in other publicly available areas, and I share a great deal of sympathy for those people in those communities who are facing that. But equally, these are sadly the necessary sacrifices that all Victorians are making to get us into the position where schools are open, where businesses are open, where community sport is happening, where we are able to ease a whole range of restrictions that allow the economy to kick up again and social interactions to take place at least in some large number of circumstances. And until such time as the 70 and 80% vaccination levels are reached, we can expect to have some forms of restrictions on our movements.
Those QR compliance protocols exist in aged care homes and hospitals. Is there any chance that those two activities get allowed before the 2-week cut-off? Is that being considered by the public health team, speeding up those restrictions being eased?
In terms of easing the restrictions?
Yeah, getting people into aged care homes and hospitals to visit people.
Not that I'm aware of, Paul, but if you mean, does it mean that our highest risk areas, such as aged care and healthcare settings, are going to ease arrangements before next Tuesday? I'd be surprised because we all know, and we've seen it in New South Wales just recently, I understand there's been an outbreak of COVID in another nursing home. Hopefully everyone's vaccinated and they've got that level of protection. But we know, Victorians know, we had a terrible winter in 2020 with impact on our private residential aged care facilities, and we need to take measures that keep them protected.
Where are you at with negotiations for pandemic laws as opposed to using the state of emergency and keeping on renewing it?
Well, we indicated when the legislation passed the Parliament earlier this year that those arrangements would be in place till December, I think December the 16th, and we continue to work through those processes in terms of engagement with those crossbenchers who indicated they were prepared to be part of that process. It's moving along steadily.
Moving along steadily, what does that mean?
That means moving along steadily, and we've got till December the 16th to land those new arrangements, and the new arrangements will of course be proportionate and reflect the fact that this global pandemic is going to extend some time into 2022.
So you probably look at the November sort of sessions of Parliament for
well, when
legislation.
those discussions get to the suitable point, we'll have more to say.
Last question.
Sport is a reason to cross the border in the border bubble.
I beg pardon?
Sport is one of the reasons to cross the border. Is it all sport? Can you go across the border to play golf?
Yes, you can.
With regards to vaccines, we've got our new Pfizer timelines taking effect from today. What's the take-up been of appointments in our state-run hubs?
Well, I could get those actual figures to you, but we continue to see pretty steady and impressive figures through our state-run hubs that as a proportion of Victoria's total provision of vaccines, our state-run hubs are providing about just on 50%. On the weekends it's more than 50% because GPs aren't as busy. During the week it's a bit under 50%, but overall bumping around half and half with our GP, pharmacy and other networks. That's a pretty impressive figure, particularly compared with how other state-run clinics in other jurisdictions are going. We'll continue to expand those clinics around the state as Pfizer and other vaccines increasingly come online next month and the month after, all with a view that the Horizons process that General Frewen and his team have put in place can expect to see the provision of further Pfizer to really crank up in the coming months. In terms of what we've done for extending the 3 weeks to 6 weeks, that arrangement for the first and second dose, that arrangement is just kicking in today, so it's a bit hard to make projections, but we are confident that that will be widely supported by people, and we'll see front-end loading quite a number of people come forward and get that important first dose of Pfizer to give them substantial protection from getting COVID and from that protection from hospitalisation and severe illness. And then in 6 weeks' time, when there's substantially more Pfizer in the system, as we've been promised, that will allow us to then give the second dose to equally a lot more.
Given how things have run in fits and spurts though over the last number of months since we've been vaccinating at all. How confident can we feel that we're going to have that supply there in 6 weeks' time?
Well, that's a question that I think you'd have to direct to the Commonwealth first and foremost. It's the Commonwealth who provide the vaccines to the states, but we are confident, particularly since Lieutenant General Fruin's team have taken over, that all the projections that they've made about what will be provided have been met, and on that basis we're quietly confident that the projections that the Lieutenant General has provided our team will be met, and we'll build up our program based on those commitments.
Do you have a figure on the number of second jabs that have had to be postponed as a result of this move?
Oh, well, no second jabs would be postponed. So if you were booked to have your second jab from Pfizer before today's changes kicked in, that won't change. So there will be no...
So it's only from today?
It's only from today. Okay. So if you had your second jab booked in, then that will continue over the next several weeks.
Do we still have Pfizer bookings available at our mass hubs for this week?
We certainly have a lot more first Pfizer bookings now available as a result of these changes, and I would encourage Victorians to get on this coronavirus.vic.gov.au and make your booking should you be eligible, and of course remind people that our GP networks and now an increasing number of community pharmacies are also acting as venues for variously Pfizer and AstraZeneca.
And so the families of AFL players being granted exemptions to fly from red zones?
Not that I'm aware of, but if there is an exemption process that applies to anyone, but there's no particular carve out for AFL families. Everyone goes through the same process.
And do you know how many, how many exemptions have been granted for travel to New South Wales?
There is a figure. Rather than me make it up, I'll make sure that we provide that to you. But as Kate indicated, we are prioritising those critical end-of-life, critical care and other compassionate grounds before other grounds. And there are many, many thousands of exemption processes in the system, and reasonably I think we do prioritise those people who want to make sure that they get here before loved ones pass away, funerals, those kind of things.
Just two quick ones. Are we closer to giving assistance in New South Wales on contact tracing, and also on Victoria's consultations with the ATAGI on their recent change in advice? Is that advanced at all?
On the ATAGI issue, we continue to work through those, and we'll probably have more to say about that shortly. But AstraZeneca is a safe and effective vaccine that anyone who wants to come forward and get it should firstly, of course, seek the advice of their GP, but what that then means for our state-run clinics we'll have more to say about shortly. And in regards, what was the first question?
Contact tracing health.
The support for New South Wales. We've still got many, many thousands of primary close contacts to clear through our system, but we continue every day to talk to New South Wales about a whole range of other measures of support, policy issues, engagement strategies that go well beyond contact tracing, but at the moment the contact tracing arrangements haven't changed. Any other issues?
Yeah.
Thanks everyone. See you shortly.